will not read it all the way through, you'll have an opportunity to have this copy for yourself. And this is the consent form, and we have this consent form basically to inform you about your rights, and basically you to check it off and initial that. Thank you.
So how many houses do we have in this complex?
Well, we got
You go
that one
70,
at
15.
705. And then you're going to go to...
Okay, go ahead. I'll get 715.
Okay.
719, 7019.
Hi. Hi, how you doing, ma'am?
Very well, thank you.
I'm Bill Morris. I'm from the University of Wisconsin, the Survey of the Health of Wisconsin. Eligible to take part?
Sure, that'll be fine. Come on in. Certainly, come on in.
Thank you. And this is a random survey, and your household was randomly selected out of all the households in the state to take part in it. Has a doctor ever told you that you had peripheral artery disease? Have you had a tetanus shot in the last 10 years? Have you ever had the three-shot series for, to begin with, what is your, and can you tell me your birth date, please?
Yes.
Okay, how many years ago was that? And if so, when? The purpose of it is to...
Oh, you sure? Okay.
Yeah.
Okay. Then we're confused.
And we're going to be doing taking your blood pressure, and the way we do it on the machine is everything. You just relax for 5 minutes, and then we have you all measured for the cuff. Pull this up for you a little bit there. Okay, and you can just relax your arm there. Okay, now we'll start the machine. Oh, okay, there you go.
We're going to press this button. You're going to stand up straight. You can take a deep breath. Deep breath. Put your mouth around the opening. Push really hard. Keep pushing. Keep pushing. Keep pushing. Don't lean back. Stand up straight. Push, push, push. Keep going. Come on, come on, come on. That's it. Okay, now let's see how we're doing. Here is the capacity of your lungs. Two important the force of that first second of exhalation. The bottom one is the capacity of your lungs.
Have you ever had major surgery?
No.
And was your grandmother diagnosed with diabetes as a child or as an adult?
As an adult.
Were any of your biological or blood relatives ever told by a doctor or other health professional?
My little sister.
Do you have any artificial joints, pins, plates, or other types of metal objects in your body?
I don't.
You don't?
Mm-mm.
Do you have any coronary stents? Are you willing to do this test?
Sure.
Okay, thank you. If you could put your arm right here and roll up your sleeve. (120/81). Thank you.
Nationally, we have surveys that have been conducted for over 30 or 40 years that are specifically designed to understand the health of a nation as a whole. But we don't have anything of that sort at the level of the state or the communities within the state. So through the endowment that the Blue Cross Blue Shield endowment that the school received, we established this survey of the health of Wisconsin, trying to get a snapshot of the health status of the population of the state, so we can understand what are the problems affecting the different communities of the state, so that we can then health professionals and public health professionals can design, working with the communities, what kind of interventions or public health programs can be implemented, and moreover, to see how these programs improve the health of the population. Whoever is picked is kind of representing the community as a whole, and hopefully agreeing to provide that little time in their busy lives to help us, but also help the communities to know about their health. We give them the results of some of the tests we conduct, which hopefully will be helpful for them in terms of knowing more about their health and provide this data to their physicians or healthcare providers. The data we gather is labeled, for each person is labeled with a random number, and is completely de-identified. Names, addresses, everything is removed from the data. So the data, investigators, or researchers, or healthcare providers that will have access to this data in the future will have no way to link every piece of data to any individual subjects that participate in the survey. All that identifying information will be kept in secure, logged cabinets completely separate from the actual health data. The results will be shared with public health officials, with healthcare providers, with researchers, so that we have more information about the health of the communities and individuals and the health needs of the communities in the state. We'll publish annual reports, and we'll do scientific analysis of the data to try to identify patterns, trends, things that work, things that don't, communities that are better than others in terms of certain health parameters, and try to identify the reasons why certain health problems are more frequent in communities than in others. And we hope that other communities and other researchers and other public health or healthcare provider professionals will add to the survey when they are interested in specific components on data we have not been collecting, but they are interested in for their own community. So we'll be prepared to collaborate with communities and with other professionals that want to add to the survey certain components, data we have not been collecting. Wisconsin is poised to be a leader in the nation in this regard, and that will be the only state where this type of information is available. We will have ways to examine what we do to improve the health of the communities in a very rigorous way. Will help us to and help healthcare officials and public health officials to plan accordingly, to not just based on gut feeling. A lot of things we do in public health is because we think telling people not to smoke or telling people to do physical exercise or eat less or don't eat so much junk food, etc. We think that those things should work, that people are going to follow our advice and then their health is going to improve. But we really don't have hard evidence that that's actually the case. Some messages we convey to communities work better than others, but without having a way to assess that, to see what works and what doesn't in terms of public health campaigns and interventions in improving the environment, improving the community, improving access to healthcare. There's no way to do this, to examine what works and what doesn't in any kind of rigorous way. So SHOW will give us 15 years from now the chance to actually do that and see over the last 15 years what has been the evolution of the health of different communities. Has been improving, has been worsening, is worsening more than in others, etc. And what are the differences that community from community in terms of determinants and health outcomes, which will help us plan and evaluate what works and what doesn't.